Tēnā tātou katoa. Good evening. General surgeons have written an open letter to the Health Minister expressing what they say are grave concerns about the state of the health workforce.
They say some hospitals are essentially just doing acute trauma and cancer surgery, with the number of cancelled planned surgeries ballooning.
Health New Zealand says the cancellations haven't changed significantly in recent months, but those on the front line say that's not the reality. Investigations correspondent Michael Morra has the story.
Very thin abdominal wall though, eh?
General Surgeon Rowan French is worried. He's only doing a fraction of normal planned surgery amid an exodus of key staff.
A real crisis developing in the workforce that we've never seen before.
He's penned a letter to the Minister saying surgeons are gravely concerned.
Most of the hospitals are really just doing acute surgery and cancer surgery and probably a little bit of cardiac. But all the rest of the planned care, the elective surgery, just isn't getting done.
In the 11 months to June 26, 13,410 planned surgeries were cancelled or deferred. But Health New Zealand says the number of patients deferred or cancelled hasn't significantly changed in recent months.
I don't think any of us buy that. I mean, you know, I personally do a lot of non-cancer surgery, bariatric surgery. I would normally have done about 20 lists so far this year in the public system, and I've done about 3.
It's the same for orthopaedics. Over the past 2 months, John McKee would normally have completed 16 elective or planned joint, foot or ankle operations.
Only done one primary elective joint replacement. Other lists have been occupied dealing with acute trauma or lists have been cancelled.
Cancelled due to staff shortages. And it's not just the lack of nurses causing problems.
We need anaesthetists, we need nurses, we need anaesthetic technicians, we need the whole kit and caboodle.
He's been a surgeon for 28 years.
The extent of the pressure and the problems now is probably as great as it's ever been.
In their letter, general surgeons have suggested nurses are offered free meals, parking and childcare. They want fees-free nursing training, cancellation of student loans in lieu of work, and they want to add nurses and allied health professionals to the top of the immigration and residency list. Health New Zealand says this year's COVID outbreak is to blame for planned care delays. Surgeons think otherwise.
The first step in any problem is acknowledging it, isn't it? And, I think to keep suggesting that it's a winter problem, it's a problem due to flu and COVID, when what we're seeing on the ground is that permanent vacancies are the problem, not sick leave, permanent vacancies.
Vacancies they need filled and urgently.
Well, kia ora, Michael. You've just heard from the Minister. What did he have to say?
Yeah, well, Andrew Little says here that he's received the letter and will respond in due course. He says the health workforce has been under pressure for a long period of time. The government's acknowledged this and the system will change. Health New Zealand told me that there is a plan to improve planned care and cut that waiting list, but they were unable to give me any specifics for exactly how they'll do this. And this is why surgeons are concerned. Rowan French told me he knows nothing about the plan, and in the meantime, the wait lists and the issues for the people on it only get worse.
Michael Morra, thank you for the update.